The semester has ended for most of us, and we're thinking about what changes we need to make for future semesters. This is a time for us to reflect on what worked great with our students and then perhaps what didn't work quite as well as what we had hoped. Welcome back, everybody, to Dr. Sellars Educate. Our mission is simple. It is to support every nurse educator to pass the C&E exam and also to help us be better nurse educators in the classroom. Now, we do that by using the best resources, aligning our teaching strategies with evidence-based practices, and listening to the voices of our stakeholders. That includes our students, that includes our alumni, our healthcare partners, our community members. There are so many great contributors to our curriculum that we want to make sure that we are making those evidence-based changes that are going to help support improving our student outcomes. There's research that talks about us preparing our students to be practice ready. More recently, there's more research coming out about the importance of us helping our students become residency ready. Now, I know not all healthcare organizations have residencies, but for those that do, we should consider, when we look at our transition to practice course, opportunities really to identify what specialty is it that our students want to engage in, or perhaps what are some of those foundational elements that we want to make sure we close the loop on with our students in the final semester for clinical practices. Maybe the first semester, students were not grasping concepts related to adult health or specifically looking at health assessment. Maybe there is some skill development that we want our students to really focus on in that last semester. And we want to be able to give students that feedback in a way that is objective with some clear learning objectives and specifically student learning outcomes that we want them to achieve. Now, all of this content that we're talking about is aligning with the content that we're going to cover today in our snapshot, which is taking a look at revisions to our curriculum to ensure that we are aligning with those evidence-based practices that are going to best support student outcomes. And ultimately, we know that it also leads to better patient outcomes. The first step you want to take is to print out the study worksheet. That's located right here in the description. And the second step we want you to take is go ahead and write down whatever today's date is that you're watching this snapshot. We know that everybody's at a different point on their journey, whether you are just focusing on being a better nurse educator, or maybe you're on the journey for C&E or renewing your C&E. That's the journey that I'm on right now. So wherever you are in your journey, we're here to support you until you are successful. That is our guarantee. We're going to follow a little bit of a different format in this snapshot. We're going to start by identifying our resources first. Okay, we use content from Billings and Halstead Teaching and Nursing. Right now we're in the 6th edition, but there is a 7th edition available, and there's a crosswalk also right here in the description, so you can take a look at that if you have the 7th edition. Okay, Elsevier was kind enough to share that with us. So on page 185, in fact, the entire chapter 10 focuses on what are those learning experiences that we're engaging our students in order to ensure that we're going to meet our program outcomes. So page 185, looking at designing those learning experiences. Specifically on page 186, you see that there's a list of 3 major principles that we want to think about as we develop and design our curriculum, specifically our learning experiences with our students. So we have unstructured and structured learning, we have active and passive learning, and integration of the 3 learning domains. Okay, so starting on page 188, this is where you're going to see a really thorough breakdown of each of the 3 learning domains. And I want you to do that right now. Go ahead and write down what are those 3 learning domains, and specifically, what are those teaching strategies that align with those learning domains that you're using right now in your classroom. We use the term classroom generically. That can be the sim lab, the skills lab, or the clinical setting, okay, depending on where you are. And then page 527 as well, that is the Bloom's taxonomy, Bloom's wheel. So make sure you use that, page 527, as a resource as well. Now, I know it's a little busy, but it really is laid out well. So I do want you to take some time to explore page 527, the Bloom's learning wheel. And then, as always, we like to take a look at table 14.1, exploring the learning theory. We know when it comes to the C&E exam, you can expect 70 to 80% of the questions to be at that application and analysis level. That means that it's not enough just for us to have that lower level learning of remembering. We have to be able to identify how that specific theory shows up in our classroom, okay, which is very appropriate for the topic that we're going to be talking about today, which is alignment with those evidence-based practices. So students can not only make patient care decisions that are in the best interest, providing the safest patient care possible, but also making sure that we are aligning our curriculum to progress students in our nursing program and to help them be successful, not only in our class, but also when it comes to the NCLEX. We know that that is the final summative evaluation with our students is the NCLEX. They have to be successful on the NCLEX. All right, so let's go ahead and take a look at our content for today. We're going to use Prezi. We like to switch it up every now and again. Okay, so I'm going to share my screen and I'm going to start just showing you kind of what it looks like to first open up your Prezi platform. So this is an overview. Okay, so this is the deck that shows all of my slides that I've developed. And you can see the topic of our time together today, which is integrating evidence-based practice, specifically looking at alignment with our nursing curriculum. Now, the great thing about Prezi is each of these stacks or each of these tiles, I like to call them, there's content that you're able to build based on the curriculum that you've identified. So we're looking at primarily 4 areas. We're looking at the importance of EBP. We're looking at what teaching strategies we can use to really enhance that student's experience. How does it align with our curricular adaptation? And then how do we best support the facilitation using an interdisciplinary approach to ensure that we are aligning our teaching strategies with what the evidence says we should be. Okay, so first taking a look at why is this important? And how does this show up in our clinical practice and in our classroom? Well, first and foremost, we want to go and look at our learning objectives in our course and identify any gaps in learning that you have discussed or perhaps even been concerned about throughout your course. Because remember, this is a time for us to debrief from the semester, because if you're watching this live when it was released, then you know we're at the end of our semester. Okay, some colleagues may have already started their new semester, so it's important to take time to reflect on what worked well and what didn't, and to make sure that there's still strong alignment with the evidence-based practice. This helps us not only, it helps students achieve success in meeting those program outcomes, but it also helps develop those critical thinking skills because we have such strong alignment with what the evidence says our teaching strategies should include. So our thought-provoking question for this snapshot is aligning curricular changes that we're making with evidence-based practices. When developing a nursing curriculum, which of the following frameworks is most appropriate for ensuring the alignment of educational goals, learning experiences, and assessment methods? All right, so we have 4 options. We have Andragogy, Bloom's taxonomy, Maslow's hierarchy of needs, and D, Knowles adult learning theory. Now, we've heard from some colleagues that have taken the C&E exam recently that there are still 4 options on the exam. Okay, and then other colleagues, they tell us it's 3 options. We maintain confidentiality of the exam, so we don't ask any other questions. And the other question we ask is whether or not you felt prepared for the exam, because that's data that we like to track as well. So that's the reason why you have 4 questions or 4 options here. We know that you could have an exam that has 4 options, so we want you to be prepared for that. So what is it that we mean when we talk about implementation of evidence-based practice? Well, you want to think about what are those patient care policies that are being put in place at our healthcare institutions? And are there policies aligning with the content that we're teaching in the course and that we're validating in our sim lab and in our skills lab? We want to make sure that there is not only strong alignment, but that there is effective integration in our nursing curriculum. Our goal is that we're able to enhance our students' learning skills, developing the critical thinking skills over time, making sure that students have a solid foundation in considering clinical judgment And what that model is, looking at the NCSBN model, or maybe looking at Tanner's clinical judgment model, but really following those steps in the process to validate that students are advancing their knowledge and they are making safe patient care decisions. We want to role model these evidence-based practices by citing our references, right? And we want students to go to the literature, to engage in scholarly work by exploring what the research is saying about, as an example, new medication that may have come out. We know there's lots of weight loss medications that is commonly in the news. And so maybe there's an assignment where students can go and do a literature review or literature search to identify what the latest evidence is saying about a new medication for cholesterol or a new weight loss medication. This allows us to promote excellence in patient care by integrating these evidence-based practices. We want to talk about them in our didactic in our classroom setting. We know that that's the first level to bridge theory to practice, as described by Patricia Benner. So our ability to engage in exploring the evidence-based practices based on the literature, having discussions with students about what the evidence says, engaging in those unfolding case studies, using a flipped classroom model so students actually start the learning process before they arrive in our classroom. When we use the flipped classroom model, it also allows students to be more self-directed in their learning. Okay, we know that there's a role for pedagogy in our higher ed experiences, because we want students to know for a fact exactly what the steps are when they're following sterile technique, right? We want them to understand that we are the expert using what the evidence says, looking at our textbooks, looking at the literature to make sure that the current evidence is aligning with what the textbook says. How many of us know that once a textbook is written, it's already outdated, right? So we want to make sure that our current content in our curriculum really is aligned with what the patient care decisions are in the actual clinical space. Our ability to do that, if we can go back, starts with our connection with our clinical faculty. So we want them to be involved in our curricular conversations. We want them to give us feedback about any misalignment with content that's taught in the class, in the skills lab, even content that may be included in our textbook. If it's outdated, we want to know that information so we can make the changes appropriately. And then the impact. We know that patients receive better care, and ultimately our community is safer and they have better patient outcomes whenever we are doing our heavy lifting on the front end to make sure that our students are using the most current evidence-based practice, clinical documentation, and clinical decision-making processes to ensure that our students are learning content that they need to in our classroom. And this is going to establish the foundation for them to show up in the clinical setting well prepared. Okay, and we know that it's a continuous process, right? We gather data, we gather feedback from our students, from our faculty, even from our stakeholders in our community. And when we have an advisory board that includes our community members, that includes our healthcare partners, this is going to help us stay connected and ensure that we are aligning with these evidence-based practices. Curricular adaptation, we want to take time to reflect on what was effective that semester and how our students' performance align with the goal of completing those learning objectives. If students struggled, as an example, with sterile technique, then we want to go back and look at alignment with the content that we use to teach students about that clinical skill, and looking at practice opportunities that students had to make sure that we gave them feedback about their clinical performance in the skills lab, that they had a chance to practice, and then looking at their actual bedside performance. So how did students make patient care decisions in the clinical setting? Were there gaps, or did the clinical faculty feel like that they were able to close the loop and help students really grasp those concepts in a way that allows them to apply and analyze? And then how do we work together as an interdisciplinary team? What is the literature saying about a specific clinical practice and how we should work more collaboratively. Let me give you an example, and that's related to patient rounding. We know that there's lots of people that go in and out of patient rooms. So is there an approach that we can take with our interdisciplinary colleagues to ensure that we are all aligned, and that when they are going into the patient room, that they are also assessing for those 5 P's as an example, that they're thinking about, if it's physical therapy, when they do assist the patient to get up to the chair, what is the proximity of their call bell, of their water pitcher? So just being mindful that it's not only the nurse that's responsible and the CNA for making sure that we are implementing these evidence-based practices. We want to bring our colleagues along, our allied health professionals as well, to make sure that we are collaborating and that we are supporting the best patient care experiences possible. Empowerment, this is important. Thinking about, what does the nursing profession really mean to our students? How are we integrating the image of nursing into the curriculum? I know that when it comes to Jean Watson's model, a lot of us are seeing in the research and at conferences that there's almost a resurgence of adopting her model and looking at the professional image of nursing and what those care and behavior should look like. Also looking at Patricia Benner's novice to expert model. How are we integrating that into our nursing curriculum, and what are those outcomes? What changes are we seeing as a result of those improvements? We know that it's a continuous process, that our curriculum is something that we should always explore, especially not only at the end of the semester, but even midterm. You know, are students performing poorly on the exams? Is there an opportunity for us to look at the resources that we use instead of using strictly looking at a textbook? Do we want to incorporate additional current literature, current evidence to best support closing the loop and bridging that gap with our students? All right, so next steps for you. Thinking about the textbook, okay, so looking at Billings and Halstead and going over the pages that we talked about, chapter 10 specifically, and really closing your knowledge gaps related to revisions that you want to explore to ensure that we are aligning with EBP for our curricular changes. And then study worksheet number 2, go ahead and complete that all the way. And then I want you to develop a binder that is going to really be a resource for you to make sure that you are maximizing your study time by focusing on any gaps that you may have. And then third is the study workbook. Okay, so that's a resource that we do make available to colleagues that may be struggling with being clear about how much time you should spend focusing on each competency. Maybe you've already taken a review course, but you're off track and you don't know how to get back on track. The study workbook is an excellent resource to help you do that. All right, so as we close the loop, let's take a look at our thought-provoking question. If you chose B, Bloom's taxonomy, you are correct. And it's no mistake that we talked about page 188 and 189 in Billings and Halstead to help you close your knowledge gaps. We want to make sure we're aligning our content with the thought-provoking question as well. Okay, and then to summarize, integrating evidence-based practice into nursing education is going to equip our future professionals with those skills as well as the mindset, thinking about role modeling, right? Being a scholar, creating a continuous improvement culture in our classroom with our students. When students come to us and they say, oh, well, in the clinical setting, we took 6 steps to complete the STIL technique process. Digging deeper into what the students are seeing in the clinical space, right? And just making sure that we are creating an environment where students can speak up for clarity's sake and that we're able to answer their questions. Well, we hope this snapshot has been helpful. Again, we use Prezi, something a little different, and we also use Canva to create our thought-provoking question. But we encourage you to reach out if you have questions, info@drsellarseducate.com. We hope that we will see you in our next snapshot next week. You can tune into our channel where we release a new snapshot every single week, and we always align our content with the blueprint. We actually looked at about 3 different competencies in this snapshot. So you want to look at competency 1 and also competency 4, looking at curriculum, and then also being a change agent and leader. We know that some curricular changes can be difficult to implement, right? So we want to take some time to consider how it's going to affect our colleagues, and then looking at a change model to adopt in order to move forward with that change effectively. All right. Well, that's going to wrap up our time for this snapshot, and we will see you in our next one. Have a great one, everybody.